Imagine a world where the issues surrounding drug use are treated with serious debate rather than sensational headlines. For years, drug use among American teens has been rising, with recent surveys showing troubling trends. As this problem persists, public discourse about drug policies has intensified. The historical stance of highest-profile administrations, such as the Bush and Reagan campaigns, focused on strict drug policies. This has changed little over the years, contributing to a growing divide in opinions about how best to handle illegal drugs. Opponents of current policies argue for tougher penalties, while others advocate for legalization, proposing that it could mitigate the problems of crime and corruption linked to illicit drug markets. Legalization is often misunderstood. Some see it as decriminalization, which means removing penalties for possessing small amounts. However, others might think it implies complete deregulation. This misunderstanding leads to confusion in discussions about the implications and consequences of legalizing drugs. Despite ridicule from various factions, the question of legalization continues to surface in media. Incidents linked to drug use and influential figures advocating for its re-evaluation keep the debate alive. Still, no one seems to define exactly what legalization means, leading to hollow discussions that fail to critically address this controversial issue. A real examination of drug legalization needs to delve deeply into its potential impacts. Supporters point to benefits, like eliminating black markets and reducing serious public health issues associated with illicit drug use. They argue for a reallocation of resources from punitive measures to education and addiction treatment. Yet, advocating for legalization is not simply lifting the prohibition on drugs. Rather, it requires tackling various regulatory challenges. What type of drugs would be available? How would they be supplied and consumed? Each of these questions opens the door to ineffective discussions absent of specificity. Both proponents and opponents of legalization rely on historical evidence to strengthen their arguments. Critics point to increased consumption rates seen in previously restricted markets, while supporters highlight patterns of falling drug use prior to strict bans. However, without understanding the underlying regulatory measures, these claims remain abstract and unconvincing. Moreover, concerns about crime don't fade under legalization. Will black market opportunities persist? How can access to drugs for young people be regulated? These questions loom large as potential pitfalls become glaringly apparent. The international implications of drug legalization can't be overlooked. If the US decides to move toward legalizing drugs, what happens to global drug control agreements? How might other countries react? Similar past policies in places like the Netherlands underscore the risks of becoming a magnet for drug tourism and trafficking. Unsurprisingly, massive uncertainties overshadow any aspect of drug policy reform. A trial-and-error approach allows for bias and inconclusive results. Therefore, any substantial shift would demand bravery amid embarrassing uncertainty about possible outcomes. This signals the need for in-depth analysis now more than ever. It's crucial to test proposed regulatory frameworks, learn from potential costs and benefits, and thoroughly assess America's drug control policies too. The question remains: what will it take to reformulate drug policies in a way that addresses today's changing landscape? Open, thorough discussions must take precedence as we continue to face deteriorating drug situations both domestically and overseas. The Brookings Institution remains dedicated to providing independent and impactful analysis on these pressing matters, offering insight and clarity in a complicated and often misunderstood debate surrounding drug legalization. Engage in the discussion today. What do you think about drug legalization? Share your thoughts in the comments below.
Thanks for watching Zenvix. Subscribe for smarter health and science.